Nice to see you. All right. A lot of people I know. Thanks for being here. Okay. Hi, everybody. My name is Adriel George. If you don't know me, I'm a foreign trained dentist originally from Pakistan. I came here in 2016, did a master's in health administration. And then after when COVID came in, I applied to 20 schools and I got accepted to.
Recording in
Is my volume is fine? Can you hear? Can you guys hear me fine?
Yes.
Yes. Yes, doctor.
All right.
Yep.
Okay. So when I came in 2020, when COVID, I came in 16, did a master's, and then after that, I worked for 2 years in a nonprofit organization, and then COVID came in, and at that time, I was applying for dental schools. Right when COVID came in, like exactly in those days, I was applying for Colorado, and I got accepted to 4 schools at that time. We didn't had any bench exam because COVID came in. They changed everything to virtual bench exam. It was a lot of transition. So I got invite from 6 places, gave interview at 5. OP, I did not give interview because I already had acceptances and I didn't wanted to do extra at that point. But I got accepted at UCLA, USC, Colorado, and NYU. Ended up going to Colorado, graduated in 22, and now I work as a GP in Ohio. But over past 5 years, if you don't know, I started making videos regarding Caapid. And I personally enjoyed it, making videos, how you should write your personal statement, how you should prepare for your uh, interview preps. That's my favorite part. The one thing that I love the most doing is preparing people for interview. Writing is a little bit more taxing work when you have to write. But this is what I started doing about 5 years ago. Some of you might have seen my videos, some of you might not. I'll try to share a link afterward. But this session I wanted to do because the Caapid cycle, if you're not aware, is starting on March 3rd, which is pretty much 1 month from today or even less than that. And what I wanted to discuss is that what are the big problems, big issues, big mistakes that a lot of candidates make. And I would encourage you if you want to ask questions because I'm right now talking to myself on the camera. But if you make it interactive, if you have any questions in between you want to ask, that will make my discussion a little bit better because I can gauge what your questions are and how we can work from there. Okay, so you're more than welcome to ask questions in between. All right. So I'm going to start off with the mistakes that most commonly I've seen, and some of these you might already know. So the number one thing that ev- most people, I know people who had really good profiles and they reach out to me and said I did not get accepted. Number one thing I'll tell you is that having a good profile, yes, it's a good thing, but it's multifactorial. Do not rely on one thing, that just because I have good TOEFL score or I have passed my exams and have really, really good GPA, or I have a master's, or I have 10 years of experience. Sometimes candidates would message me, oh, I have a very good profile and I know I'm going to get accepted. And I tell them not to be overconfident. Honestly, it's a multifactorial situation. Number one thing that you want to avoid is that don't get late in applying. Now, there is a balance. What I tell people now, number one thing you want to do is apply as soon as humanly possible. Because some people will say that the Caapid cycle is opening on March 3rd. I want to apply by 5th. Well, if your letter of recommendation are not uploaded, your dean from back home, Pakistan, Venezuela, or or from India or Nepal is on a vacation, and you have to wait. You can't do anything. And one thing now I use the word, I don't say apply as soon as possible. I use the word apply as soon as humanly possible for you. That is a very important thing. A lot of schools have given feedback to students over time. I've learned this from my own journey as well. That imagine one way to make this process easier is, imagine if you were working in the dental school. It's a business. People won't like this, but it's just like Walmart or Amazon. And it's a business. They have to recruit 40, 20, 18 people every year. So they want to do this as soon as possible and get done with it with less problems. So what you want to do in this process is be helpful to them by applying early and being professional in your communication. The second thing to avoid, the mistake people make, a very, very big mistake, is that they think the more we will write, the more we will tell, it makes us look good. There is a there is, we need to understand that right now when people go on websites for dental schools or overall institutions, they will say we like diversity, we like people who went through hardship, we encourage marginalized people, and a lot of females, a lot of people who are coming from minority group. And I grew up as a Christian in Pakistan, so I'm also kind of like a religious minority, so I can understand that perspective. But they think, including myself, I would think, oh, if I write a lot about being a minority and putting all of that emotion in there, they will like me. Well, to be honest, there is a more important thing that is prevalent in US, and Americans are very straight to the point. They get very easily annoyed. If you live in New York, you realize that if you go in a McDonald's line and you're waiting for 5 minutes to think about the order you want to make, there will be seven people behind you just hating you or cursing you for taking so much long. American behavior comparatively is straight to the point because don't waste our time. So the key thing I'm going to tell you, I did an interview with a Serbian doctor who got accepted to UIC and then later on went into endo program. And she said to me, brevity is the key. It's a sign of intelligence that you are able to convey your message in less words. So if you can speak or if you can inform the school, this is my story, and you can, or this is my email in less words, you're actually being more respectful and saving their time. So one thing I've commonly see a lot of mistake is that people, I know we have a lot of journey we go through. You're paying a lot of money. You're coming from a place of aggression that you're like, I want to prove this to the world. I want to prove it to myself. And you're pouring your heart into it. Remember, you are doing this, but the person who's sitting on the chair on the other side, or now when I see every year they read the same story, they meet the same person coming from India, Venezuela, Cuba, or Middle East, or Iraq, telling them the same story about the war going on, the problems they had as a female, or the problem they had to see through migration or financial issues or coming from small town. So your story might be very unique to you, but remember, for the other person, it might be the same story being repeated. Now, you want to be unique, but you need to keep the other person in mind too, because sadly, I had couple of people who went through divorces and stuff, and life happens, shit happens, it's fine. And you can mention things that you went through hardship, but you don't want to make it a therapy session. You want to discuss the problems you went through, but you want to make it sound okay. I went through some hardship. I had some issues, whether mental issues, physical issues, but it brought me into a person who's much more stronger
Yes,
and
this
more
is
intelligent. All right. Uh, does that make sense, guys? I hope I'm give like making sense up here.
Yes, absolutely.
Okay. Any questions, guys? I know there's a lot of people, so if anybody wants to ask any question, because right now I'm a talking head, feels like I'm talking to myself. So just want to make sure if anybody has question, they can write in the chat box to you, or if you want to unmute and ask, go ahead. Okay. So number one thing I told is
Hi, Doc.
yes, Doc.
Hi, Doc. How do we send out early emails to school? What should be the content in it?
So
Um,
good question. First of all, thanks, Doc, for joining. Good to hear you. And the way I would say is, Doc, one thing I got to learn this because I was working in a non-profit organization, and I had to nonprofits actually have to raise funds and stuff. And one of the things I've learned is that when you write your email, you want to be straight about, I'm a foreign trained dentist from this country. Now, since this is your introduction, don't start off by writing, my name is Adriel William, my name is Jasmine Diol, or my name is like whatever your name is. I just read from whatever was in front of me, but do not start off from there. Uh, mention that you're a foreign trained dentist from India, Cuba, wherever you're from. Then, along with that, mention that you have done this, because that's the most important thing. All of you guys are foreign trained dentists. But if I, just giving you an example, if I have to write, I would say, I'm a foreign trained dentist and I've been fortunate. I'm not saying I have done it. I'm saying I was fortunate to do a master's in health administration from Maryland. I previously was part of the oral and maxillofacial surgery residency and now worked in a non-profit as a coordinator for about 2 years. And the reason I'm reaching out to you is because I am very much interested about your university of blah, 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 because that university provides this, like you want to do some research and mention that this university has something very good. And I was interested to know that, can I learn more about your program? And you can use different words, but this is, and I don't want everybody to go and write the same email. That's just going to look stupid, trust me. What you want to do is you want to use the principle and invent your own idea, and just keep it very straightforward, because to be honest, I don't have a better word, but this is a pollination pollination season for schools. Right now, they are very open to students. If you email them, comparatively, they will reply you, they will talk to you. But after March, they will become kings and queens. They won't reply you because they will be super busy. There will be 1,000 application. They have to go through, they have to report their bosses. So they don't really care about your emails at that point. So I would suggest that. Yes, Dr. Bhuktavar.
Doctor, I was just wondering, let's say if we reach out to a school and they don't write back to us, what would you suggest? Do we continue to like reach out to them the second time? Do we just wait on it? How do we go about that?
Forgive them for their sins. And I would say that at this point, you can reach out a second time. Maybe you can give a short call, because things get, but again, this is a place where because there can be a couple of reasons if somebody is not replying to you. One reason can be, and at times I forget to reply people. If there's somebody I haven't replied, I'm sorry. At times it happens. Sometimes email, there's a bunch of email in the office. They were busy. They were out for vacation. They forgot. Second reason people don't reply is because you annoyed the hell out of them and they don't consider your request to be serious. And so they kind of like overlooked it. So if you're going to tap them again, my suggestion would be that your communication, and of course with your previous education, you're good at it, but you want to be very professional, that I am reaching out to you in regards to the previous email I sent and wanted to see if there's any opportunity to learn more about your program. That's it. If they don't want to reply after that, just let them go. What the problem is, for example, Toro just sent a lot of people acceptances yesterday. A lot of people were put on hold. And I had candidates who emailed them 7 times. Sorry, I had a flu, so forgive me for that. But they would email them, and I was telling them, don't email more than twice. Like, just because one of my biggest issue, the third problem I'll tell people in this conversation to avoid is the mindset issue of thinking this is a charity work. People will reach out to schools, to even at me at times, but nobody is doing a charity. This is a business. You need to learn how to negotiate. And one of the key thing, if I'm going in to buy a house or buy a dental practice or telling my patient you need braces or something, I have to negotiate. I'm selling the treatment. It's a business. In the same way, when you are going in, you are actually negotiating. And one of the weapons you want to have in your arsenal is good communication. That is the key thing. Even though you might be the best candidate, best score, all of that, but if you don't know how to phrase yourself or sell yourself, you're at a disadvantage. So one of the key things I'll say is communication is the key when you're going. And do not, please do not think this is a charity. Stop begging to school. Stop acting like you deserve charity. One of the most I think this don't do this because it really puts a bad name to all of us as a dentist. When we keep begging them, these office managers, these people who are program coordinators, they are just, with all respect, they are not doctors. They are bachelor degree people who got into, like, few of the people I know were even younger than me, who when I was applying. But because we as foreign trained dentists are acting so desperate, then they start to treat us really bad. They won't reply, or they will say, like, one of the schools emailed me. I did a master's from Maryland and the transcript didn't reach that school. And they emailed me, if your transcript doesn't come by tomorrow, your interview will be canceled. And I was already working for 2 years in US, and I was thinking, you can't do that. Who the hell like, you can't communicate like that in US. This is no way to, like, are you freaking threatening me or what? And this is a university in Maryland. This is not coming from Pakistan. So I emailed them, the Maryland University, put them in CC and wrote down that you need to send it because these people are trying to threaten me to take away my dream interview, right? So the point I'm trying to make, number third biggest point is, do not think of this as a charity and learn to communicate. I'm not saying be aggressive, like, give me this, I want this, I deserve this. Do not act that way. Ask fairly, but do not act like a charity case. Even though if you are broke, you're suffering, keep your dignity with you because that will take you longer in this journey. Trust me on that. And I'm not saying be aggressive and be rude. Like yesterday, I have to tell this story. I had somebody reach out to me. Toro sent an interview to some people. And this person was actually kept asking for discount. And I said, I can certainly help you to a certain point. And then they said, no, I want more. And I said, I'm not selling vegetables. Like, take it or leave it. I'm overwhelmed with work. I can't help you more. And then that person was so angry at me and told me I'm rude and blah, 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 and all of that. And I'm like, okay, fine. It's fine. But the point is, the other one case is when people act like a charity. The other case is when people think that they deserve it. Like they have some kind of, uh, I forgot the word that we use. But
Entitlement.
entitlement. Thank you. Thank you for studying at Harvard. Thank you. But the point is, uh, entitlement. Yeah. So you don't want to look entitled. You don't want to look like a charity case. So my suggestion to all the candidates, please, whenever you're emailing schools, whenever you're talking to them, key thing that will make you stand out in 1,000 people is communicate professionally, straight to the point. Do not beg, do not be aggressive. Find that sweet spot where you're actually professional and you're conveying your point. So that is one of the most important points. Okay, I had some questions. I'm going to go to them. What are the tips to write SOP without going off track? What are your tips, not trips? Okay, okay. So in the tips, I would say there's a couple of videos I posted. I'll share that in the group later on with you. You can read those. Those should help. But I think one of the biggest thing I can say from my experience, first of all, no personal statement can be ideal. Each and every personal statement will have its issues. It's never gonna be ideal. So never think that it's supposed to be ideal. The number one thing I was gonna say in personal statement, the biggest tip I'll tell you, your introductory paragraph, that's the most important thing. You can write it in 7,000 different ways. People will start with a quote. People will start with a personal story. People will start with a sound like, aha. And I've read these kind of personal statement too. Whatever it works. But as a journal principle, I'll say that number one thing that in a personal statement will help you is your first paragraph. All right. Since we are talking about a personal statement, one other point I wanted to tell you, a big mistake that a lot of candidates, if you're I would encourage you to give attention to this point. This is a very, very, very important thing I'm going to tell you. I've been thinking about it for a couple of weeks. There's something called Pareto's law. Some of you might already know this. If you don't, write it down. I want you to read it. It's called 80-20 rule, Pareto's law. Pareto's law state that 80% of your success comes from 20% of your effort. Let me give you example. When I was giving ortho back in BDS in Pakistan, one of my senior came in and said, there are 20 chapters and in this time you can't read all 20 of them. So what you do is go and read chapter 3, 5, 6 and 8 because 80% of the questions will come from these 5 chapters. So what I did, I read those 5 chapters and 80% of questions came from there. The rest 20% came from other. Now, use the same concept and put it anywhere else, anywhere in other business, in your jobs, in your admission cycle, is that 80% of your
Recording in progress.
I'm recording. Okay. So what I was saying is that 80% of your success is going to come from 20% of your effort. Now, in this Caapid, does this Pareto law make sense to you guys? I know it might be new to some people. Does this make sense what I'm saying about the 80-20% rule?
Can you give it maybe clarified with another example, please?
Okay. So
Thank you.
imagine I run a general dentistry office. Okay. Now I do ortho, I do fillings, I do cleanings, I do everything that general talks, whatever. Now I realize that most of my patients who come in and who are the happiest and give me good reviews and make me money are actually extraction patients, surgery patients, are wisdom teeth patients. And then I realize that actually I am mostly making money or good business or getting success through this 20% of procedures I'm doing. Rest of them are more work and less results. Does that make sense what I'm saying? In the same way, when you're dealing in any business in life, anything, you realize you're doing 100 things. But out of those 100 things, 20 things are the one that are producing the most result for you in your life or in your work or in your job. And really smart businessmen, really smart practitioners, dentists, human beings, they figure out that 20%. And then they keep playing with them. That's how Elon Musk, as a freaking immigrant, is one of the richest person in the universe because he figured out those 20%. He's really good with his patrons. You can see those patrons and he kept replicating them. So what I'm saying is that you need to figure out those 20%. For example, I run this Caapid, right? This business. I figured out if I make videos, people come to me, and if I do interviews, it produces me the most result. People are much more the happiest with me. I'm happy. I make money. They make results. They get accepted, and it's a win-win situation, right? So in every now, it doesn't mean I have to not do writing and other stuff. Yes, Doc, are you asking me a question? Okay, all right. I consider that to be a no. All right. So what I was saying that so in this process, now let's take this idea and put it in Caapid. Now, Caapid has a lot of things. You have to write emails professionally. You have to apply on time. You have to write personal statement, interview, all of that stuff. So, but I can break down the 20% most important stuff in this whole process is that, yes, your personal statement and your communication should be good. It should reach to a certain level. Now, I meet people who would sometimes spend two 2 months on just writing a resume. And I tell them the the admission committee is only going to spend 10 seconds on your resume, really quick. They're going to skim it and move forward and go to the next thing. Now, if you're spending so much time on a thing that's not making like that much result, it's a waste of time. Yes, your TOEFL score will make the most difference. Your TOEFL score, your dental assisting experience, your personal statement should be good to a certain level. After that, even if you get it written uh, by Shakespeare, it won't make a difference. It should be good, but to a certain level to get that attention. But if you keep working on it and spending too much time, you're wasting that time. Maybe you can go and improve TOEFL. Maybe you can give ADAT. Maybe you can do volunteer work. Right now, all of you guys, I'm openly telling this, this is a big loophole. People who can use it, reach out to schools, go for visit day, travel, invest money, but visit schools. It will really increase your chance to get an interview. I did it. I went to Colorado, I went to Indiana, and I went to UIC. Indiana and Colorado gave me interviews at that time. The rest of the schools I couldn't go because COVID came in. But over time, I've learned if you visit them, schools, I've met people who run residencies. They said one of the key thing in acceptance we see is how many times this person came and shadowed us. That show us that this person is showing interest. So if you have the money and the time to travel, do that. Does that make sense, guys? Yes. Escape. I hope it's not Shah Rukh Khan.
Hello, Doc. Would you suggest to go after we apply to the schools or before?
After March 3rd, they're not gonna do anything for you. They shut down their doors. They act like the royal queen and king of. They don't even reply emails. Like Colorado, most people reach out to me that I'm trying to email them. They are not replying. After March 3rd, they don't. They don't let you in. Yes, doc. Dr. Nardeen.
Yeah, you mentioned visiting a school and invest and going and learn at the schools. But what basically we should like be observed, and when we go to school, like I visit the school, then what should I do there?
Which
Like,
did have you already visited any school or?
yeah, I'm my goal, like one of the schools that I wanted to go to is Boston University, BU. So I visited the school. I make a tour there, which enrolled student take me there and started explain things. It was like interesting tour, but like how should I reflect that in my application, and what is the thing that really attract the admission committee
Okay.
for my visit to the school?
Okay, I'll answer that.
Thank you.
So a couple of things I'll tell you. When you visit schools, I tell people that it's very hard to explain, but I can't tell you like when you walk in, this is how you walk in, say hi to people, shake hands, look them in the eye. That's something very hard to explain. But there's something called emotional intelligence. What I tell people, if you're taking out the money and the time to go to visit or preceptorship or anything like that, sorry, one thing you want to do is make them remember your name. You want to be a positive person. If you could go and just create a good impression. People remember you not for what you tell them, they remember you for how you made them feel. Okay, let me grab. So what's really going to make a difference is how you make them feel up there. When you're there, you want to look somebody who's a positive person, meet with the staff, meet with the faculty. That's very important. And along with that, just be positive and genuinely ask questions. One of the things what happened, sorry, one of the things that happen, people will go in and they are like, they go and take a paper and pen. They're like, how do you use oxygen with nitrous? How many carpules you use? How much time you spend? And they are acting very nervous and desperate and like trying to impress. I have done research in with some Boston, like they would go and say, I've done research with a Harvard professor. I have done this one. So I tell people when you're going in there, you want to be relaxed, just try to be a positive person. And when I used to go there, my main aim was that after I leave, they should remember Adriel. That's it. And one of the key things, how you treat, if you're shadowing there for a couple of days, if you're doing preceptorship, the way you treat the lower staff, like the people who work in the lab or who give the instruments or the receptionist, make sure you remember people's name. I This is a very sad reality, but people who are good looking and people who are extrovert always get favoritism. I learned this as a ugly boy when I was in my school, high school. People who are good looking always get away. So if you're a good looking person and if you're an extrovert and you can go and treat people well, you remember their name, you're confident, you look energetic, you're coming with a like a motive, like it seemed like this person have done the hard work and they want to get somewhere. That's one of the key things they are looking in your personality. So it's not you who's trying to impress them, they are also trying to think whether this person would be a good fit in our school or not. So if I try to tell you, go and ask this question or go and do this, those tips and tricks won't really work because anybody can do that. But what really makes a difference is your presence. And I would say just be open and ask questions which genuinely comes to you. If you hear something, see something, ask positive. Like one of the things I did in Colorado, they had a Q&A session and people were saying, what should be my TOEFL score? How long should my dental assisting? And I was just sitting in there and being the weird guy I am, I just asked them like, what do you look in okay, academics apart, but from a personality standpoint, what are you expecting in a candidate? What are you looking in a candidate? And Dr. Baskin looked at Dr. I forgot the name. Was the program director was Dr. Town. Dr. Baskin looked at Dr. Town and she was like, we don't have an answer. And they said, we don't exactly know. I was like, fine, okay. So I made my mark. I asked them what. So I'm not saying to ask weird questions, but just be yourself. And if you're confident, just bring the best version of yourself. And that's the best way, I would say. Because if you're worried about impressing them, they are also worried about getting the right people in their school. And if they get the feeling you're somebody who's positive, who's a good team player, key thing I'll tell you, treat the lower staff good. Be nice to the dental assistant. People are looking at you when you remember their name. One of the magical thing, I'm now I'm getting a little bit older. I'm not so good at it, but I used to be really good, or I would make a lot of effort in remembering people's name. Like I would go the second day again and say, I'm not good at this, but I'm gonna again ask you your name, please. And I do it like I would do it 7 times and people would blush or people would be really happy, like, okay, at least he's making an effort. And one trick to remember people's name, I'm just going off track, is that make, if you hear somebody's name, put an object next to it. Like if somebody's name is Adriel, you can remember Adriel with A, Adriel with apple, something like that. And it makes you whatever remember, like put an object or some memory next to their name and you remember that. This is a very small thing, but I think these are small things that can make a lot of difference. That's the best suggestion I can tell you. Okay, Dr. Alkar, I know you were asking about AGD, right? Doc, you there?
Hello.
Yes. How
Hello.
do you pronounce your
Thank,
name? I just said it wrong, I think.
yeah, you were right. Okar.
Alkar.
Yes.
Where did you originally graduated from, Doc?
I graduated from Azerbaijan Medical University.
Okay, nice. Are you from
Okay.
Azerbaijan?
Yes, I'm from Azerbaijan.
Okay.
Yes.
I haven't met many candidates from there, so that's
I
good.
know. Yeah. So this year I got accepted to AEGD program and I got waitlisted to USC. I was already like in the beginning, I was thinking that maybe I have to apply again, but now I already got accepted to AEGD. I'm thinking maybe I have to just go there. What do you think about it? I know that you answered me, but
Okay. The there are okay. I'm good, and thank you for asking this because a lot of people ask me this. I want to give them two answers.
Uh-huh.
it depends on your maturity level, how you look at the universe. When I got accepted to USC and NYU, and I was going to Colorado, people were like, "Oh, you're crazy. USC is such a good school, and NYU, they are Ivy League schools, and all of that, blah blah blah." And in my head, I'm thinking, whatever gets me the least amount of student loan, so I can make money, because people that I sat around were older dentists. They told me no patient cares about your degree, your GPA, or your school. What they care about, are you legally licensed in that state to work, and how you treat them and take care of them. And I personally have learned, and this is one of the reason I do social media, because when I'm not worried about money all the time, I can treat my patient better. But if I have a goal, in corporate, they give you a goal, you have to make that money. You're not treating the patient, you're just thinking about the money. So as a practitioner, I think you will be much more at freedom if you find the route with the less student loan. Number one. Number two thing about AGD comparison to DDS, DDS doesn't teach you shit. I'm sorry to say. Some people might not like what I just said, but they don't teach you crap. They make you sit and just do didactic, and then they put you on mannequins. And I'm thinking, I'm paying $300,000 sitting here, taught by SRPs, by hygienists, how to scrape of this. I could have gone to Florida and get a license and learn on human beings. But most of my classes were doing this. And it's not just mine, most schools are like this. I got an award in oral surgery because I did the most amount of extractions, which was 18. Other people in my class were coming out with 8, 7. They would give you mobile teeth and let you extract that. They don't teach you ortho. I'm giving you reality. I was talking to an orthodontist, a person who has a pediatric residency done and an ortho residency done. He's a older person who teach courses at university. He said it from his mouth too, which I already know, that orthodontists, oral surgeons, endodontists lobby and pay to dental schools so that they don't teach DDS any specialty work. So understand what I'm saying. In DDS, on purposely, they don't teach you big stuff. By big stuff, I mean you make more money by doing wisdom teeth, by doing ortho, by doing molar endos. You don't make money doing SR, like doing prophies and doing fillings. They don't teach you that. They teach you these kind of things. They don't teach you big stuff. They keep you away. They keep you scared. They keep telling you, refer it. That's what they teach you. So you actually, when you go into DDS, you're mentally reversed. I know people who said we were far more brave in doing extraction, but when we came to DDS, they scared the hell out of us, and now we don't like to do extractions anymore. So if you now compare it to AGD, most AGD are much more hands-on. There's more advanced training, and you do much more advanced stuff. Now, for the sake of world, to show people back home and to brag, yeah, I want a DDS next to my name. But to be honest, the more mature and faster route to growth is AGD. Now, the downside of AGD is that if you do 2 years of AGD, you can only get licensed in 7 states. I don't remember all the states. I know Ohio, Illinois, Washington, and Virginia with 1 year.
Yeah, after like 5 years, including the 2 years, you are able to practice all over America. They do
So
that.
I was hired my first job was hired by a person who did a GPR, 2 year of GPR, and he was making millions of dollars in Ohio. Nobody cared. I was a DDS, I did a MHA, I did all of that, and he just did a GPR.
Okay.
And so, and he in his GPR, his training, they taught him sedation, they did OR cases, they did far more bigger things than I did in DDS. And the problem is, when I went to school, I was 30 years old. I was like, I'm not getting any younger. This is the peak time of my life. And you are using my 2 years, putting me in debt and teaching me to be scared in life, which I'm not willing to take. And then you're teaching me SRPs and perio diagnosis, and like they know it. And there were professors who would let you do a little bit bigger stuff, who were a little bit open, and they will literally fire those guys. The schools hated those people. They would restrict. Right now, look at the quality of everybody knows this. This is no hidden truth. I'm not like came up with a new idea. This is in the dental world, everybody knows this, that the schools are ripping off people by doing this. And my biggest sadness is that there's so many people who need care, dental care, but these people aren't doing the things that they are supposed to do. They are like the Catholic Church back in the dark ages, like they are keeping people away from education. So to make it precise, I'm sorry for the long emotional answer that I created, but if I could go back and if I got an admission in AGD, I would have gone way better. I don't want
Thank
to.
you, doctor. Yeah, thank
Yeah,
you. Just one more question. As to that, my main concern is because in this program we are not getting like DDS degree. Is there any possibility that eventually U.S. government will say that
US
we don't
government
accept it?
listen, let me tell you, US government doesn't care about degrees, they care about the job you get. The job
Okay.
is dependent on your license. The license is dependent on the state board. So every state is different. US is very, very, very complicated when it comes to states. I knew somebody who did not graduate, who did 2 years of DDS, but did not get graduated because of a reason. And that person did ADEX, didn't had a DDS degree, but had 2 years of training, right? And they were able to get license in the state of Maine.
Okay.
So what you're saying about the US government, it's all, they don't care. It's DMD, DDS, ABCD. They don't care. They care if you have a job. Yes, we need you if you're a licensed dentist. How did you become a licensed dentist? That's you and between the board.
Okay.
Okay.
Okay. Thank you very much for advice. Thank you.
Sure.
I wish luck to all the applicants. It's really stressful process. Thank you.
Okay. So next question, Dr. Manideep, you were gonna ask something. I know.
Hey, good afternoon, doctor. How are you doing?
Yes, I'm doing good, doc.
So my question is, how often you should email the colleges that you already applied and gave the bench exam, and right now you're in a process of on a wait list from college. So how often you should email them about
I
about
said
your
it
profile
earlier, just
updates?
email once professionally and then leave it. If they are not giving you acceptance, they lost. You just go back and continue to work hard, because you need to believe in destiny too. You gotta work hard. There's a balance between your physical hard work and then you let the universe decide. I'm not saying totally become a yogi and leave it on the universe that the dental school will come and walk into your home and give you acceptance. But again, you email them once professionally and then leave it as it is. Because when you get waitlisted, there's nothing in your hand. It depends on the other party. Like if a student drops out, then it depends on what list are you, what number are they put you on the wait list. You don't know, I don't know. Sometimes they like people who already live within that state, live within, because they know this person can easily get in. So there's so many factors involved. I don't even know all the factors. So if I was you, I would just email it once and leave it.
Got you, doctor. Yeah, thank you.
Yes, Dr. Buktawa, you were going to ask something.
Yes, doctor. Thank you so much. The perspective on the fact that dental schools are not really, teaching a lot of clinical skills to already trained dentists. I think I wanted to hear your perspective on the fact that as opposed to doctors who are already specialists and who have had a lot of clinical training in a certain specialty back home, I can understand why they might find DDS not very useful. What is your perspective on somebody who is just a BDS, who has not done a specialization and maybe They have some clinical experience, but not a lot. Do you think the DDS degree doesn't teach much more than what a BDS degree does back home? Or do you think maybe there's some value to that?
So to answer your to answer you quickly, Doc. So I was actually, my friends used to say you benefited the most from your DDS. I did, because I was surgically trained in Pakistan. I did not do much resto. I did not do much fixed pros crowns. And in Pakistan, BDS doesn't do any crowns. Like, this is one of the weird things that I realized, that in India, an Indian BDS candidate or from other countries do much more crowns. We never did crowns. And I did ortho, I did surgery, but not that. But in US, DDS is mostly based off fillings, crowns, a few partial dentures, one or two complete dentures you get to do depending on the school where you are going, and a lot of perio. The point is, it's not like you make the best, the smartest or the greatest people I've seen are the ones who make the best out of every situation they are thrown in. The point was, I went in there. Did I had another way to get a license? If I have the option to go to a AEGD, I will go there. If I don't, I will go wherever I need to go in. Like Columbia charges you $600,000, $500,000 for a degree. If I get accepted to only Columbia, will I go? Yes, I'll go. I just need to learn how to make the best out of it. So you can go in and learn a lot of things if you know how to take the juice out of a lemon. You have to milk the situation. So that, I don't know how to teach that. It's just you need to have that perspective. Okay, whatever the crappy situation is, I'm going through loan. Let's make the best out of it. The reason I was saying all that stuff to her, because she had the option to go to an AGD. So I'm pushing her to go to AGD and make money and relax rather than being under more loan. But for people who don't have the option, then you go and do whatever you have to do.
Great. Thank you so much, doctor.
Sure. Sure thing, Doc. So the next question somebody asked was, what is the best time for applying March 6th? For applying March 6th till, Dr. Shiva, you asked this. Do you mean like, so Dr. Shiva, the answer would be you apply as soon as possible.
Excuse me, hi. I have another question. Would you recommend that we visit schools in person, or is it more important to focus on preparing for TOEFL exam?
Well, this is a situation which I say you have to find your own, like you have to pick your own poison. If you will ask me at this time, is TOEFL important? I'll say yes, it's very, very, very important. If you ask me, is visiting school important? I'll say yes, that makes a lot of difference too. Now, the point is, you might have job, you already might have job, you might have family responsibilities, you might have financial constraint. For you, TOEFL might be difficult. So I don't know which to pick for you, right? Everybody is different. I don't know how far the school is from you, how much traveling you have to do physically, how much taxing it is. So you need to decide. Yes, TOEFL is number one, and you can always request schools if you can do a virtual tour. Maybe that might help. But obviously, making that, imagine if I'm going in to impress somebody, to make them, if I have to tell somebody that you're very important for me and I really want to show them that, obviously, uh, obviously going physically there really proves that, like, this person had the guts to take that time off and physically go in there. That does make a difference. But obviously, if you have other responsibilities, some people have kids, some people have money constraints, so you have to pick whatever works for you. Does that make sense, Dr. Shiva?
Yes, thank you. I went to UPenn's tour previous cycle, you cannot see the admission committee or somebody in an admission. They only link you with one student and they show the university to you. You cannot have any communication with admission, or you cannot see them, or you cannot go to their office. Also, Rutgers is like this. And for UIC, for USC, I already had a one by one interview with admission committee, and I'm in East and it's West.
Okay.
I don't
Okay.
know.
Let me explain you a little bit.
Thank you so much.
Every school have different criteria, right? Some say you can come, we won't talk to you. Some student will take you for a tour, right? Okay. That could happen, right? Some school will say we won't even see you, just come. Is there a kid up there? Okay. All right. So, okay. So, what I was saying in that situation, okay, this is a very, very, very important point that I want everybody to understand. This is like a secret thing. If you figure this thing out, you can play a lot of things. And Dr. Patel, I'll come to you after this. So the most important thing I'll say is you need to build a mindset, build a capacity to figure out to make the best out of everything handed down to you. For example, if I was you, you said you went to UPenn, but you didn't meet anybody except for the student. And the student walked you around, showed you the campus. You got the idea, oh, this is their sim lab that they really brag about. You're like a sponge who's collecting information. Now, next thing I'll tell you, this year and last year, their program director have been doing Zoom call with people. It's a very straightforward Zoom call that they do, straight to the point, no blah, blah, blah. They've just talked to you for a few minutes. What you can do is you can write in your personal statement, in your supplemental application or somewhere that I was fortunate that I actually physically go and observe the student and learn from them what UPenn has to offer. So even though you might think that when I went there was no program director, no admission committee, but somewhere in your file, in your communication, they will know that this person came for a visit. So the point that I'm trying to make is you need to learn how to take out the juice out of the lemon that is given to you. There's the book I shared on my Instagram, and it said like you need to learn to make lemonades out of when you're passed on lemons. So in your case, if you didn't meet anybody, you just went in there and saw the campus, even observing things. For example, Colorado has a meatball in the center, or they have sim lab, or they have a wet lab in the sim lab, or they have the uh, clinical area. I don't even remember everything now, but there are areas that which only a person can know who visited there. For example, meatball. Now, when sitting in my interview or when I'm writing my supplemental application, I can mention that during my visit, I was fortunate I got to learn about your digital lab, and I was really happy that the student showed me the famous meatball area. Now, when I said this, the person who's reading it will know that this person actually visited the place. For example, if you're from Tehran, or if you're from Delhi, or from Lahore, or from Havana, there will be a very famous food stall up there. And if I say I got to eat a burger from that food stall and I name that place and that street, you will know this person actually visited Tehran, or this person actually visited Havana. So that way they connect to you. So the point is doing visitations are good. The next point is making sure you know how to use it. And one other thing I'll say, all of these recipes, all of these formulas will work if your TOEFL score and your INBD part is good. We can try all the hacks, but if your house doesn't have good pillars, no roof will stand on it. So if you have to fix your TOEFL, I would say go and work on it. because money can buy you preceptorship, money can buy you coaches, money can buy you trainings, a lot of CEs, but money can't buy you TOEFL. So I would conquer that first. All right.
Thank you so much.
Sure thing, Doc. Dr. Patel,
How can we schedule these tours? Like we have to reach out to the faculties or do they have something?
did you join us late?
Yeah.
Okay, it's fine. When I'll post the recording, in that I mentioned like a template of how I would write an email and reach out to them, reach out to the program director or the admission coordinator or whatever the office is, and just introduce yourself briefly and say that you're interested to know about the program. But when you go back to the recording, you'll hear a more detailed answer on that.
Okay.
Okay?
Thank you.
All right.
Yeah.
I felt like a school teacher when I said, did you join us late? So, okay. All right. Somebody asked me about, do you offer one-on-one session to discuss the prospect and so on? Yes, Doc, I do. Depends on what your needs are. Currently, I'm not doing more writing work because I have more people than I can work when it comes to writing. So I have a wait list for that. If I get finished with the writing stuff, yeah. But if you want to discuss something, I can help you out with that part. Sorry for my coughing part. It's just viral flu. Does not having green card or citizenship affects your acceptances to college? I want to know the reality. I heard that those who have green cards eventually get picked up. Sure. Well, I'm going to give you since you want to know the reality, I'm going to give you the reality, Doc. Both get accepted. My class in Colorado, 40 people, there might be about 20 or less than 20 who were citizen or green card holder. The rest were F1 student visas. A lot of them were coming from Canada or India directly. So to answer you, both people get accepted. Now, what I tell people that everybody has some kind of disadvantage. Some people here might have a green card but might not have good TOEFL score, or might not have a master's, or might not have clinical. When I applied, I never did dental assisting, and the schools knew it. I knew it. In my interview, they told me you never have picked a handpiece in 4 years. So everybody has disadvantage. One of the things I've learned, people who realize that in the universe, everybody comes with a shortcoming, but some people, some people are able to focus on the things that are controllable. Can I get a green card really fast? Maybe no. But can I improve my TOEFL? Can I make some money and do preceptorship? Can I get better coaching? Can I write my personal statement better? Can I communicate better to schools? Yeah. If you can work on those things, you would be able to do better. So what you're saying, green card makes a difference? Yes. Does people on F1 get accepted? Yes. But the people in either case, I know so many green card holders who are not getting accepted. It's not like the green card directly goes to heaven. It doesn't. The point is, people who get accepted are people who are positive and who know how to make the best out of the situation you have. And the key practical thing is control the controllable. There are certain things like people who are coming from certain countries, their GPAs are very bad because of the EC conversion. I had Syrian candidates. For some reason, EC doesn't like Syria's evaluation. They just give them really bad GPAs, which is fine. Even schools know that. But what you do is you take good TOEFL scores and you do other things right. And when you say that EC GPA, like it came what it is, they just know it because you're backing it up with other things. But if other things are bad too, and then you're making excuses, then you're just somebody who likes to make excuses. That's the overall perspective of it. I hope it makes sense, Doc. Okay. Next question. How to send LORs when different schools have different requirements since Caapid allows 3 to upload? Well, usually you upload main 3 up there, And then if you have extra, for example, University of Indiana, and I'll tell you one mistake to avoid after this. LORs, there's a lot of mistake that happens with LORs. So this is a very, very, very important point to look at it. Is that LORs have a lot of mistake happening. Back when I was applying, one of my recommender uploaded it, and thank God to Indiana University, they emailed me back and told me that your evaluator did not signatured it. Fix it. Rest of the school didn't even tell me that. So that could happen. Sometimes our deans in India, in Pakistan, in Cuba, Venezuela, Iraq, Iran, they disappear. The dean changed, the university shut down, went on vacation, something like that. Everything gets delayed. All right. So what you want to do is you want to reach out to them timely and get it uploaded. The third big mistake, recently, you might have watched those reels, Fear Unlocked. One new fear unlocked. One of the candidate who did not got accepted last year with really good profile, reach out to school, said, give me a feedback. They said, well, here's a feedback. We got 2 evaluators, 2 letters, both have the same content. What happens? Schools back home are lazy. Rather than writing a letter of recommendation, the whole school has one template. They copy paste on everybody's signature and upload it. And in American schools, that is plagiarism. There is something wrong. They don't understand that our freaking dean and our faculty is lazy. They are lazy bums and they did not want to write a new one. So they just copy pasted the same template that the school had and uploaded. So the other thing I'll say, if you're uploading, make sure your evaluators write something new, like different letters. So that's something important too. And to answer, if you have an extra LOR that needs to be uploaded, you can upload it in the supplemental section. There's always an opportunity to upload extra documents, resume, certificates, blah, blah, blah. You can upload there, or you can ask your evaluator to directly email to that specific school. Okay. Now, whom should we meet? The admission department or the staff? If you're going there, meet everybody who's willing to see you. The point is, you're not the one who's going to meet them. They are the one who's going to say, I'm free. Like, if I was you, I would meet the whole freaking university if I can. They should remember me. But whoever gives you the time opportunity, go and say hi to them. Make sure they remember your name. Since you're spending that time and money to go there, do it. Dr. Manideep, you have a question?
Yeah, doctor, it's about the LORs. So
Yes.
if you're reapplicant, should you change anything in the LORs, or should you ask your evaluators to resubmit the same one?
They can resubmit the same one. It doesn't, there's nothing bad written in it. You don't need to change it. Date matters. It should not be older than 2 years, I think. That's something you should look into. If like it's 2025, it was signed in 24, it's fine. But if it was signed in back in 2022 or 3, that's kind of old.
Also, I wanted to ask you how to approach someone, like you said yourself, deans are lazy and some of the professors I try to approach are lazy too.
You're from
Yeah,
India?
doctor.
Bribe
Yeah,
somebody.
doctor.
Ask the local
Bribe the
minister
clerk.
to ask the local minister or some person to email to call that office and say get the job done. This is how you get. So what I did, now putting jokes aside, I didn't never reach my dean. I know he's a surgeon from England. He wouldn't give a crap. So I the PA, I found their number directly and I said, hey, remember me? If you don't even remember, now just make it happen, please. And I was really good at requesting, and she helped me out and got the things done and uploaded.
Yeah, got you, doctor. I'll try that. Thank you.
Back home, like if you have gotten this far, you should be able to manage India's system. I don't think I need to teach you that, doc. You should be able to figure out one way or another. Make them a deal that they cannot refuse.
Yeah, I did the same thing in my first application too. I contacted the clerk in the college and got the dean to get the application. But even the clerk, they are not technical savvy, I
Doc,
would say.
the point is, I can't teach you India's system, right? I'm from the other side of the border. You should ask your friends who are really clever back home. Tell them, get it done. That's how I would do
Yeah,
it. So
gotcha,
you would
doctor.
know your hometown better than I do. So figure out who can get the job done and get it done.
One more question, doctor. Do you know anything about these publications that goes on around WhatsApp groups? Like usually, I
I
did
would
my
stay
own
away
public.
from them. I would stay away from them. I never, I had, I can proudly state I never had a research, I never had official publication, and I got accepted to four. I know a lot of candidates, Indian candidates, I don't know why they've been buying these publications or I don't know what's happening. I'm not directly informed about it, but I think it's just becoming a joke. Don't do it. It doesn't make, rather use it to do something better.
Gotcha, doctor. Yeah,
Yep.
thank you.
Okay, sure.
Mhm.
Sure thing, Doc. It's okay. Dr. Reddy, you asked, can we apply to AGD residency with INBD? Can you explain about ADA pass match? What is a good TOEFL score? If we are not ready with everything until April, Doc, those are like 7 different questions, but you need to watch more videos. If you don't know what a good TOEFL score is, I think uh, starting off with that, being above 100 is the basic average, but these days people who get accepted are 105 or above. I'm sorry if some people got scared from hearing that, but that's what's going on. You can apply to AGD, but not without INBD. Without INBD, nobody even wants to talk to you. Nobody wants to reply you. Do not waste their time and go and do your INBD, go and do your TOEFL, and then the next thing is what is good TOEFL score? Yes, again, I mentioned if you're not ready with everything, well, you can apply even after April. I'm not saying you can't apply. I'm not saying you can't get accepted. They, but the point is first do your INBD, TOEFL, and then figure out what you're going to do next. Because if you're trying to do a lot of things, I personally have sadly reached a point because there are so many candidates reach out to me. I say, what's your TOEFL? Have you given INBD? When they answer me that, then I'll say, okay, let's talk. But if you haven't done that basic work, then I can't help you at this point because there are 70 other people I can help. So my criteria over time has been do your exams and then I will tell you what to do because you're trying to drive a car without tires. Go get tires in your car and then I will tell you which way to turn and which way not to turn. Does AEGD program require some education from US to be eligible? I'm a fresh graduate from Pakistan. I don't know. Every AEGD is different. They do require mostly, they like to get green card holders mostly, but some of them don't. They like to, I don't think they, I don't know if they specifically want you to have a degree. No, they like clinical experience mostly, but every program is different. This is something you have to shadow, go and see, talk to them, and then you will get. Doc, your volume of your mic is kind of low. Not sure if just me. Okay. Guys, can you let me know if you can hear me?
Yeah, we can.
We can, but it's slow.
It's low?
The voice is
Okay.
really low.
Yeah.
Well, thank you for letting me know. Let me fix it. Wait. It might be in the setting or my throat is going down. Either one of them. Let me, where is the audio? Oh yeah, now it's gonna, better? Is it better? Hello?
Yes, doctor. Thank you.
Okay, thank you. Yeah, I just changed the Zoom setting. Okay, thank you. Yeah, if that kind of thing happen, let me know because I'm talking to myself. I don't even can see you guys, so I don't know if something. Well, thank you, Doc, for letting me know. Okay, is it bad to have a big gap between your dental school application? If you graduated in 14 in Canada, since working as a dental, is this something that the school would not? Oh, they love you for doing dental assisting. It's actually your positive point. If you had dental assisting experience, it's actually a very solid thing. When it comes to the gap, one of the things I actually want to tell people And few of the mistakes that they kind of overthink is they say, oh, we have a gap, especially females. There are a lot of females who get married, who move to US, and in the first transition, they are studying, they are managing their house. Some of them go through motherhood or other part of life, visa issues and stuff. And the schools understand that. It's part of life. If if you can, I had somebody in my first, when I started off this coaching, I had somebody got accepted to University of Tufts. She made me a testimonial video with straight 8 years of gap, and only thing she did was just taking care of her kids at home, and she got accepted with that. So I don't think just because you have a gap it will stop you. They just want to see if you have a gap, and after that, obviously you had your reasons for a gap, but after that you picked yourself up and you're proving yourself to be a consistent person. So fine if I had a, like for example, I never did dental assisting, and this was a question they had. Like, you never did general dentistry much, you were becoming a surgeon, and then you never did dental assisting. I was said yes, but I was doing a master's, I was doing volunteer work, I was working in the non-profit. Mm, There's a lot I don't know, but I am one of the most hardworking person in the room. And if you give me the opportunity, I will prove it. That's the key thing. It's not about, and everybody's, what I tell people is that everybody's resume or will have some kind of weakness. It will have some weakness. So what you want to do is like just play on your strength. Don't worry about weaknesses too much. If you focus on problems, problems get bigger. I think I read it on social media or somewhere, but yeah, if you focus too much on problems, problems get bigger. So yeah, if you can fix it, fix it. Otherwise, just keep working hard and utilize that. All right. Okay, let's read the next question. Dr. Manideep, you want to ask another question? Your hand is raised. That's why I'm asking.
Yeah, doctor. Sorry to ask so many questions, but
It's fine. I'll send you the bill later on.
yeah, about the dental conferences, how is the best way to utilize those dental conferences, doctor? I've been to many of them, took so many lectures.
No, again, this is a very objective question. There's no right and wrong answer. When you go there, make contacts, learn about things, meet people, gather information. If you can volunteer with the event in the organizing part, make connections. It depends on your personality, your confidence, but if you can use those areas to make connections, learn about things, and then you can utilize it in your resume, in your personal statement. It's all about exposure. The reason we are doing preceptorships, the reason we do a lot of courses or visit school is they don't guarantee us admission, but they are proof of our exposure to the world of dentistry in US. Now, how you write it down, how you explain it and use it, it depends on you.
Yeah, got you, doctor. Yeah.
Okay. So the next question is, what are the chances of only BDS candidate getting accepted? There are people get accepted, but I don't have mass like stat on this. I applied to, I don't know if I told you, I applied to one AEGD in Ohio. I did not get accepted. Then I got accepted to 4 dental school at the same time. So I don't have a number on that. AEGD is not the normal way. It's a loophole in the system. When a lot of places, when they don't get the local DDS student, then they open up the chairs for the foreign students. Now, I don't know what the chances are exactly, because I mainly work with Caapid, but AGD, I can't tell you for sure. I never did one, so not my area of expertise, to be honest. The next question is, doctor, as a general dentistry applicant, what what's the best we can do to increase our chances to stand out or get accepted? Doesn't make a difference. You don't need to be a specialist to get accepted. Like out of the 40 people in my program, I think there will be 7 or 8 specialists. I wasn't a specialist. I did a master's in health. So they pick out, there were 4 or 5 people who were totally fresh, three to 4 people, totally fresh graduate. So about main thing that they really love if you have done dental assisting. You did some kind of clinical experience back home and then you did dental assisting. So that helps. Okay. Next question is, doctor, do you help with the revision of SOP and resumes? At this time, doc, I'm overwhelmed with the writing. I just put a waiting list on that because I think I can't do more writing or work. I've been apologizing to people that I can't take on more responsibility. Maybe if I get done with my previous work and I'm free a little bit, then I might. Uh, because what I've been doing is that I have a small group of people I do fellowship with. In the fellowship program, what I do is I work with them in their applications, starting from personal statement, resumes, letter of recommendations, supplemental applications, uh, interview preps, Casper, Kira Talent. I pretty much help them throughout the process, everything except for physical bench exam, because I can't do that on Zoom. I can't do that on phone. So for that, I usually say take a course, practice at home. But except for that, in the fellowship program, I help the candidate with everything until they get accepted. And there's a expensive charge for that fellowship, but I'm keeping that number low as well because writing is not easy. Comparatively, I can do all day of interview prep. I can speak, as you can see, I like to chatter a lot. But when it comes to uh, writing, it's like people's expectations are sometimes so high or so much different, and it requires a lot of work back and forth to find an ideal place. Uh, Sometimes people have, so yeah, I am actually keeping that door on a waiting list with the writing stuff. Zoom user, Dr. Zoom user, you wanted to ask something?
Yeah, actually, I'm about to ask the question on regarding the LOR. Can a LOR from the US practicing dentist help more in getting the admission?
So, two things I'll tell you. Number one letter have to be from the dean. That's compulsory. Now you have the remaining two, right? That's the compulsory one you have to get in. In that, if you have letters you can get from US, they will be more credible. But for example, if you did a master's from India in endodontics or ortho, maybe getting it from your supervisor will be good. But yes, if you ask me, and this is an opinion, I think US values letters from US. That's how just US is. They don't give a crap about the rest of the world. They don't take it seriously. They know these papers can be faked in these countries. They can be lied. So they usually hold US people more credible. So if you have the option, do it. Okay. Yes,
Okay,
Dr.
thank
P.
you.
Sure thing, Doc. And what's your name, Doc?
I'm Bharat.
Okay, all right. Dr. Priya, yes, you had a question?
Hello, Doc.
Hi.
I have a few questions, like it's very basic, but I want to confirm. So, in CV, is it important for me to put my INBD and TOEFL score? Like,
I usually put it, when I write people's CV, I try to put it INBD pass, first attempt, TOEFL score, because the school finds it useful. The school finds it very important. For them, this is a big criteria. So again, I do it. There was one candidate who kept fighting me. No, they don't want to do it. It's totally fine. There's nothing right and wrong. You can do it. Yes, doctor. And
so
after
it's
that,
always better to write like INBD first attempt, TOEFL. Let's say if I got like 93 in my first attempt, so it's like 93 in my visa status, something like this.
If your high score is 93, I would not write TOEFL. If you're gonna brag, you want to brag with some strength, not with something which is below standard right now. Not to sound demeaning, but point is, right now below 100 is not a good level to be at. So maybe I won't write TOEFL then.
And about this online CE credit score, the people I have heard, like they say, like if you have 100 plus, you can write. If not, there's
I
no
don't
need of
have
writing.
any confirmed thought about it. My suggestion to people is you can write it, you cannot write it. It's totally dependent. The main point is your resume is a very small piece of paper that they only spend 4 to 5 seconds, that should only highlight the important things you have done with a short or a brief explanation. That's it. Now, if you feel your C courses are important, put it in, but it should not be longer than 2 to 3 pages.
Okay, even if like conference, I have attended like few conference in my home country, but nothing in US.
Doc,
So
Doc,
what do you
again,
think
now,
about
now
it?
you're just asking what I'm trying to give you. I don't give, when I'm doing these sessions, I can't go into very detailed answers because I haven't seen the whole situation. I don't know
Okay.
what else you have done. Now, for example, if you have a master's and you have a conference, master's is important. If you
Yes,
have
doc.
a degree and you have a CE, degree is important. Now, I don't
Okay.
know what you have done in your life, but whatever you feel like is important that you have done, if conference is the only thing you've done, put it in.
Okay.
Okay. So
Okay.
I'm giving you a principle, you invent your own methods with it. And there's no right and wrong. Go on Google, write resume template, you'll see 7 different, pick one. There's no
Yeah, doc.
wrong and right with this. Just be brief, be respectful of their time.
Okay, doc.
All
All
right,
right, thank you.
Sure. Dr. Shiva, you had a question. After this, we'll take a few minutes of break. I think I need to grab a water too, but yes, Dr. Shiva.
Sorry, I have a question. If already we have master and I want to get a recommendation letter from my professor, but this professor is in the dental school, it doesn't give the sense that I prefer this school in my Caapid application when I get from dental faculty from that school recommendation letter.
Sorry, I lost you. You did a master's from where?
Yeah, and I was working with a dental faculty, which with one professor in dental faculty, and I want to get one recommendation letter from one professor from my master, and I had a really a long-term relationship with this professor, so she's from dental school. If I put her recommendation letter on my Caapid profile, it does give the sense that I prefer this school or not. It doesn't matter.
Just if you have done a work with the doctor who's also a teaching faculty, get their letter.
Okay, thank you so much.
Sure. Guys, I'm going to take a quick break. I'm going to grab water. And meanwhile, you can have some water, think about some questions, and we'll discuss from the Dr. Arias will start from there. Or
Okay, doctor.
all right, guys, I'm back. All right. Dr. Arias?
Hi, Doctor.
Hi,
Marjorie.
Marjorie, right?
Yes.
Okay.
So I have a question. Before I become a dentist, I spent 3 years in medical school, and the reason why I transferred it was because a family matter, and made me realize that I wanted to pursue dentistry. So in my easy report, I have the transcripts from medical school because they transfers a few classes that I took. So should I mention the 3 years that I spent in medical school in my CV?
In CV, I might not, but in personal statement, you can mention how you got a fundamental training of basic biosciences and medical sciences through your med school. That would make you a better dentist in the future.
Okay. So it's not relevant to mention it in the CV, even though in my easy report,
It will
my
confuse
C.
them. It will confuse them in the resume. I don't know if they will think, is she a medical doctor or completed it? Or usually you write things that you complete. You mention the things that you have completed. You can, there's no wrong in it, but better off to do it to, again, if you feel like you want to do it, do it. I'm not going to stop you. But if you feel
Okay,
like
so
this is confusing, then don't.
okay, so my question is because like I graduated 2022 and I moved directly to the US, and I know I don't have like that much clinical experience in my country. Here I work as a dental assistant. So I just want them to see that I have background even though I haven't practiced like that much. So I don't know
But
if
doc,
it's worth
again,
it.
what I'm trying to tell you is resume, what I'm trying to tell people, resume is a very brief document. The best way I can explain what a resume is like a visiting card. You cannot explain a lot of things. You just have to highlight the major things. And when it comes to your stories about moving and not your reason to, because this is not a normal thing to leave med school. It's very different to leave a med school and go into dental school. Anybody who reads it wants an explanation. What the hell happened? Did she get kicked out? Did she kill somebody up there? Was her GPA too low? So it's always better off to mention this kind of critical step. This is a critical step of life in your personal statement because you're telling a story behind it. But again, this is my suggestion. You can go any route you want.
Yeah, thank you, doctor, for your insight.
Sure. Dr. Sam.
Hi, good afternoon.
Afternoon, doctor.
Yeah, so I'm a periodontist from India, and my first priority is to apply to pass. Can you elaborate on it?
So I never went through PASS myself. So there's not much I can actually give you on that. I don't know the PASS process much. I'm bluntly honest about it. The only thing I can tell you about residencies is if you want to apply to any residency, you should be going in and shadow it. When it comes to residencies, you're competing the local students. So if you want to get accepted to any place, you actually want to narrow it down, go and visit them, make connections, be sure, because residencies varies a lot. Some residencies are totally research. Some residencies are just on soft tissue grafting. Some are very much based on implantology. So they don't, and they know this. And if you don't know this, you will look naive. So if you want to do it, the only suggestion I can give you is narrow down the places and start going and shadowing them and then apply.
Okay, that's actually great advice. Thank you. But I do have another question for you. So I am a 2023 pass out. So I took an year gap because it was 8 years straight up dentistry in India, and I want to clear my head off it. So that's a complete gap year of nothing. How do I explain it in my
I don't know what reason you want to give in your personal statement, but
Yeah.
you can tell that you were working with the community or you just went out to travel India. I don't know. You can, Americans do it all the time. They go out on mission trips for a year and disappear in Africa. This is very common with Americans. So if that's something that makes explanation in your or you were taking care of your parents or something, or family life, or taking it. So that's something you have to play around with your personal statement. This is not a big issue. It's just 1 year. It's just about how you write in it in the personal statement that you have to think about it and do it.
Okay, thank you. Because traveling does line up with my personality, and I did do traveling. Because, yeah,
Okay.
thank
Yep.
you.
Sure. All right. Dr. Fiu Jamwal, if I'm saying it right.
Yes,
Yeah.
yes, doctor, you pronounced it quite right.
Yeah.
Yeah. So I have a question regarding my passport. The thing is, not
Passport?
the passport actually. I mean regarding my visa. So my US visa, I'm not getting an early appointment. Unfortunately, I have an appointment in June. I'm done with my TOEFL. I'm done with my IMBD. So I just wanted to check in, like while filling my Caapid application, can that be a problem for me?
If even if it is, what option do we have? Like, what are you gonna do? Lie? Like, if I
No,
say
of
it
course.
is a problem, what can we do?
Mhm.
So in this
Like I'm
situation,
trying my best to get an early appointment. I'm in
I'm
Canada right now.
Doc, what I'm trying to tell you is that when it comes to visa, it's not under anybody's control. The whole universe knows this. So you just state what it is. And you're in Canada. It's not like you're in India. Eventually you'll get there because Canada is right next to US. So I wouldn't over worry. Just tell them what it is.
Yeah,
Because you're
that's
in
what my
Canada.
question is, like, is it a necessity that you should have your visa? Like, no, right? Okay. Okay. Thank you.
All right. Dr. Paulina?
Hi, Pauline, actually,
Pauline,
yes.
sorry. Yes, doc.
Yeah. So I'm an endodontist from India, and I spoke to a person last year, and she told me that she had applied and she too had an MDS. And when she got accepted, she went for an interview, and the interviewer asked her that why do you want to do DDS and not residency? And she really had no answer for that. So I was just wondering if you had any way about it.
Do you have an MDS?
Yes, I do.
What?
Endo.
Okay. When you get an interview call, reach out to me. But just to tell you briefly, you can always mention that I've been fortunate that I got to learn about endodontics through specialty, but I want to relearn about the basic fundamental of general dentistry in US. And if needed, I can later on go for a specialty.
Yes.
Your
Yes.
friend did not knew the answer because she wasn't, or he wasn't, or whoever the person wasn't thinking sharp. There are
Mm-hmm.
700 ways to pull, like, answer this. If you
Yes.
think this is a big issue, and this is a problem when you get an interview, there are a lot of other things, and I have a whole playlist of videos on interview that should guide you on that when you start preparing for it.
Okay, I have one more question.
Mhm.
They do want to know from your statement of purpose why you particularly chose the United States, right? So when we write the SOP, I actually moved here because I got married to someone
That's
over
fine.
here.
Just mention you always wanted to do advanced education in dentistry, and US provides the best advanced.
Yes. Yeah. I mean, we did dream about coming to the US at
Yeah.
some point, but yeah,
Yeah,
it
just
happened because
all
of
the
this.
90% people who are applying are from India, got married, and that's how they came in. But everybody
Yes.
writes that I wanted to pursue the best dentistry, and US offers the best. Really quick, guys, I'm gonna grab my charger before my laptop dies. Just give me 1 second, I'll be back.
Okay, thank you.
Yes. So next question somebody was going to ask, otherwise I have it in the comments. How does working on research with a dental school affects one's application? Well, it does give you a positive boost if uh, it does give you a positive boost because that shows you worked. one one key thing I'd say in my videos, even if you have done an administrative job, even if you have done a dental assisting research work in a dental school, you can benefit from it by telling them that you got exposed to the culture of a dental school. You got to work with dental faculty. You got to learn about HIPAA, the professionalism, the way methods of communication, and all of those things. So it does give you a positive boost if you know how to write, like I got to learn these things from there. Yes, Dr. Harsha. Yes.
So I have a question for the answer you gave. So I have this TA experience as well as research experience from one of the top dental school in from the United States. So my question was like having an LOR from the research experience, like where I worked from like one of the
Yes.
dentists, the research professor, or like having a LOR from one of the dentists where I work as a TA, like which one
But
carries
both
the
of them.
huge weight?
You can get both of them. Get one from your dean and get both of these.
So what about like I have one more question, like because like one from the
Okay, yeah.
team back in India, and like is it like having both from United States or having another letter of recommendation from the one of the professor
Okay,
who
Doc,
knows me for the
that's what
5 years?
wait, Doc. I said this like an hour ago, and I'm saying it again. If you can get more letter from US, US likes
Uh-huh.
it better. Now,
Yes.
if you want to get two from India, totally your choice. My suggestion that I don't want to repeat it again, but what I'm trying to say is get one from India to keep it precise. If I was
Mhm.
doing it, I got one from Pakistan and two from US. But again, if you
Correct.
want two from India, do it totally fine. But that's my recommendation that I gave to most people. Again, these are just suggestions. Again, if you whatever you want to do, you can.
Yeah. Okay. Thank you.
Sure thing, Doc. So the next question I'm going to go towards is what is a major factor which needs to be considered in an LORs in terms or their writing or beside? Well, number one thing, letterhead matters. If it's a good letterhead, it matters. Like Mission of Mercy, big organizations, letterhead matters. I don't know if you heard me before, but I said the date should not be longer than 1 year. It looks weird. Try to keep it like if it's 2025 you're applying, not longer than 24. Designations, I don't know about that, but letterhead matters. Designation are mostly going to be doctors or dentists. Signatures, yes, there's like signature should be there. And on top of it, one of the key thing I tell people, letterhead matters, but along with that, the content matters too. How that person is explaining about you, what they are saying matters a lot. All right. So if your doctors write this person was somebody I worked one-on-one with, I've seen their personality, they are a very positive person, they work hands-on, they are energetic, all of these kind of stuff, that puts in more uh like that makes the LOR better. I hope that answers, Doc. The next question somebody asked, there are specific format for resume for some schools. So should we pick upload? If the school has given you a specific format to follow, like UOP, follow it. If they already given a format, then go ahead and follow it. The next question somebody asked, the TOEFL was taken on June 10, 23. I thought TOEFL is valid for 2 years. I'm not sure. You can confirm it if somebody knows, but I think most school think that it's valid for 2 years. Somebody else asked, can I send my best score of TOEFL? I don't think all score except best score. I don't even know why they came up with the idea of best score. Like, I think it just use the normal TOEFL you have, and that's what because some schools accept it, some school don't accept it, and then you're getting into confusion. So keep it simple and just go with one TOEFL basic score. Yes, Dr. Jamwal.
Thank you for giving me another chance, Doctor. I have a question. I know you have explained and elaborated on LORs, but I have a situation which is a bit different. So I thought it would be better if I discuss it with you. The thing is, I haven't been to US, but I know a optometrist who is an American, and she knows me. Can she write a LOR which I can maybe?
Knows you how? Like, did you have?
Yeah, I can explain that. Yeah, like she came, she was invited into a wedding, my sister's wedding. She's my sister's friend. So
So what
that's
will
how I
she
know
write in the letter that?
about my like yeah, that's what my question is. Like if I get a supplemental LOR where she can she being an American, she can write something about my character or my energy or something like that. Will that be beneficial in
But
any way?
doc,
Uh-huh.
think for a second. If you're a school, just be a little, like, switch places, become a American dental school coordinator, and now think that you're sitting, close your eyes and think that this person is applying from India. Most people are applying from India. There are some people who never even visited US. There are people I know, and they get letter of recommendations from India, from non-profit organizations, some American Red Cross organization, whatever they have, right? And now amongst them, there is a person who's sending an extra letter of recommendation, first of all, from another medical provider or whatever you want to say, practitioner, who met them on a wedding, and there's no professional interaction in a medical center. If she came for a mission trip in India and you were working in a medical camp together, it would have made sense. But now you met her on a wedding. I don't I'm just cracking a joke. What can she say? Like, you guys dance good together? Like, it wouldn't make sense. I'm just cracking a joke, but it wouldn't look professional. If you guys had done some kind of dental camp, charity camp, or work together, that made sense. But otherwise, now you're just that's not a professional approach in US. That can actually be considered a little bit harmful, that you're just using connections to show that you're competent, but the competency is not based over work but based over relations. And we might do this in India, Pakistan, but in US professional setup, it can actually bite you back if you like do this way.
I get your point. Yeah,
Yes.
thank you for that.
Sure. Dr. Manideep, yeah.
Yeah, doctor. My question was, how do you stand out from other people while giving an interview? Like, give me some pointers, and
I'll give you 2 pointers. One of them is I will share a whole playlist. I've been making videos for 5 years. I've made videos on each and every questions. Tell me about yourself, leadership, strength, failures. It should be more than 20, 30 hours of videos just on interview. So need to watch that because can't repeat everything. But in depth, you will get ethical scenarios on YouTube, everything. The second thing I'll say is not to be dumb. Like, the one of the biggest key thing I see a lack of emotional intelligence. Is just being emotionally aware when you're communicating to people. Is just be, if you were right now practicing in India and somebody comes from a village and you say this teeth needs to be pulled out, and they say no, I need to go and talk to my priest or my whatever and take confirmation from them, otherwise I will lose my soul. And you'll say, what the hell is this person talking about, right? He's annoying me, take him out, I'll see the next patient. In the same way, when people are applying to dental school, one of the key thing I see is just put yourself in the other person's shoe and think what he would be thinking, because he's dealing with 40 or 20 people taking interviews, and all of them are stressed and trying. People think interviews are an exam. They will keep thinking, oh, like I have to impress this person. And then this one guy comes in, Manideep, who's very comfortable, who's calm, who's having a conversation like he's having a conversation on a coffee table. And most of the questions are going to be about your personality and being aware when you're talking, like being like, I can say things in an interview, but if I'm boring the hell out of this other person, I'm losing my impression. The other thing is, there's a lot of things I say in the videos, but is catching up to the other person's energy level. If other person is want to do it really fast, quick, they are asking short questions, give them short answers, move forward. If they want to enjoy the conversation, they can ask you, how's the weather in India? I've heard like you've traveled this, I read this, what was that? They will, so just conversations are like that. But again, I'll share the videos. There's so much neat things I can go into, but it wouldn't make sense. So just as a brief is just being understand how would you like somebody communicating with you. So it's interviews are not an exam, it's a conversation. It's not a charity, so don't go in there begging. Presentation matters, and you should have a good conversation. That's the key things I can tell you. For the rest, do watch the videos. All right, Doc? I'll share those in the group, WhatsApp group. All right?
Yeah, sure, doctor. Thank you.
Sure. Dr. JT. Yep. You want to speak, Doc? Okay. I think I can't hear you, Doc. Yes, Doc.
Hello.
Your mic is on. Yes.
Yeah. So I'll be real quick. So I passed out in 2017. I gave my part 1 in 2019, part 2 in 21. So is there an expiry for NPDE parts for the application
I'm not sure
process?
about that. That's a tricky spot. I would say this week, email the schools. Wherever you're applying, ask them this question.
Okay. So I mean, like, is there any possibility that I can, if I give ADAT, will that be like helpful?
ADATs are always helpful, but the point is, I can't confirm you about the expiry part. And if I give you a wrong advice at this time and they don't consider it, you will be in a very big loss, right? You spend all this money. So what I'm trying to say is email those schools and confirm if you need to give that INBD or not. If not,
So
then
yeah, I
give
checked
ADAT.
in DentPin, so it's not allowing me to book for INBD because I already did my parts.
So again, you should again, Doc, what I'm trying to tell you, I don't have the correct answer, and the people who can give you the decision is the schools. So if you tell them this, see what they offer you. Like tell them I'd given my exams, I passed them, but it's not letting me give another INBD. So here's the result.
Yeah.
Tell me what to do. I can't tell you that, right? I don't have, and I don't want to give you. But just because I sit on a YouTube channel doesn't mean I have all the answers. And I'm very scared of giving you a wrong answer, which can waste thousands of dollars of yours. So better to go and ask them about this one. This is a tricky situation.
Sure.
Okay.
Thanks, Doc.
Sure. So the next question is, a second attempt at INBD with an average profile takes me off the table. No, it doesn't. I had people who had 7 profiles, they get accepted, who had 7 attempts but get accepted. But the point is, INBD is not the problem. The gap year is not the problem. The point is, if you had a failure, I made videos on this, you need to use a story and mention why did you fail, what you learned out of it, so that it will make you a better candidate. There are people who had multiple attempts in TOEFL, people who had failures in their BDS. It is fine. It's life. Most of us are 30 years old when we are applying. You have failures and they like to see failures, but what they more like to see more is that you learn from your failure and you have the authenticity to discuss it. So it's totally fine to have a attempt, but just talk to them. So the next question is, and I hope after about 20-25 minutes, I would be ending this session, but let's try to do as many questions as we can. I hear after doing shadowing, some clinics don't provide LOR. How can we approach US clinics? And I don't have an answer for this because you can't tell us place, I will shadow you, you give me a letter. They'll say, go screw yourself. That's what they will say. So what you do is, when you go in, start shadowing, after a day or two, build good relationship and tell them that you're applying to dental schools. And then after 2-3 days, like take some cupcakes or something and then ask them, Doc, I'm applying to dental school. Will you be comfortable writing me a letter of recommendation? They will tell you yes or no. But if day one you walk in and say, I need this, they'll say, go away. Because if you're demanding on day one, they won't. It's something you build a relationship, you tell them the problem, and then you ask and see what their answer is. I know it's a tricky thing, but that's all. That would be my best answer. Being an international student on a visa, what is the best way to approach for shadowing and considering the visa rejection during OPD period? How can Well, the shadowing doesn't is not depending on your visa. Even if you're on B1 or B2 visa restriction is on earning money. Shadow is not a paid job. Shadow is just go and see with your eyes. So nobody can stop you in US to shadow just because even if you have an illegal, you don't have any visa, you can go and still shadow. They have problems when you're working there. That's when they have problems. So if you're not getting paid for it, I think you can go and shadow doc. How can how can get a shadowing position? For shadowing positions, doc, you just have to email, go walk in, request people, create contacts. There is no single way for it. It's just knocking doors and just requesting people. The next question is, no volunteering yet, got 150 shadowing hour and a recent DA. Yes, volunteering is a good thing. Schools see that. If you haven't done it, go on Red Cross website and sign up for it. Volunteering is an important. Would working as a hygienist have a better chance? Yes. Being a, if you haven't seen my videos, doc, there's a lot of videos I made in which I mentioned that hygiene allows you to be licensed. It allows you to, especially in Florida, you just go and give exam, get your license. You can make more money. You will have money, so you can take more courses, apply to more schools, and your credibility or your overall profile gets better too. Is referral system works in US? In my in my experience, I would say no, because I just don't do it. If you want to increase your chance of getting accepted, work on your profile. Don't rely on other people because they will screw you up. I don't recommend people. That's not a good way to do things. Can I take one LOR from someone who works as a dental assistant in US? No, doc. I don't think. I don't get a letter of recommendation from dental assistants, and whoever gave you this idea, stay away from that person. That's not a right way. You need to get from a doctor. It would be. I would rather get it from India, who's a doctor who have a proper letterhead. Dental assistants are no, they are not. That's not a position. I don't know who gave you this idea. Stay away from them. That's not smart. That's a dangerous idea. How can I get your help? The reason I'm saying this because I knew somebody who was applying to Perio, and this other applicant was also applying to Perio, and he was trying to sabotage. He didn't wanted his class fellow to get accepted, and what he was doing, he told him to get a letter of recommendation from the hygienist. Go and get it from the hygienist. And when that person discussed it with the faculty, they said, that's a bad idea. Why do you want to send a hygienist letter of recommendation to a perio residency? Do you think they care about what hygienists think? So then later on, he found out that the other person was actually giving him a wrong idea, so it does not get accepted. I'm not saying your whoever gave you this idea was, but that's not a smart idea. Stay away from it as far as you can. How can I get your help to review my application? Well, right now, Doc, I have a waiting list on I I I do help with fellowships. But I have a very small number of people that I am working with. Maybe in the next few days, I might open up 1 or 2 slots for writing or fellowship program. But at this time, to be honest, I get like 5, 10 people message me, can you review my SOP? And it's just too much. I get fatigue. It's just too much writing and stuff. So I'm actually trying to restrict myself. Maybe in the next week, if you reach out to me and if I've done some of my work, I'll let you know if I have some opening. But right now I'm keeping it on a waiting list. Otherwise, it's just not wise to take on more work than I can do. If we redact the LORs, what ideally we should write on focus. Dr. Ariana, for that, I have two videos. Remind me in the WhatsApp group and I'll share it with you. It's much more in detail, so that will give you the idea. And you wrote down and it have to be valid till the start the program. Does anybody wants to turn up the mic and ask a question? Because I feel like I'm talking to myself, but does TOEFL well? Yep, go ahead, Dr. A.
So how do we choose what schools to apply to, considering, according to my profile, considering some of the information is not on the websites, like how we know that UIC prefers students with green cards, that kind of information is not available on the website. So how do we exactly choose what
There are
schools?
certain things you can get to know, but you can't, doctor, until this. To be honest, some things you will get to know on the website, and some things you have to take a leap of faith. Like some people just get accepted because somebody else dropped out on the last minute and they happen to live in the city. So you can't figure out all the things. There's a lot. That's why I say apply to 15 schools. It's just your chances get bigger because you're also applying to schools that are matching you a lot, and you're also applying to school where it can be a little bit fluke. So there's a no correct answer, because there's like Dr. Steve saying this on recording, but Dr. Stevenson once told a student, UCLA like good looking people. All right. And I'm going to brag, I got accepted there. But the point is, the reason he said it, because LA is a very aesthetically driven society. And UCLA is a party school, not the dentist school. Overall, UCLA, Lakers, and all of that. All right. So does it mean that, oh, I need to get a plastic surgery or a hair transplant before applying? No, you just apply and see what destiny decides. So there's always things like this, but they are not in our control. So just don't overburden your soul with it. Just pick the schools that you like, and then pick some other schools, 10 to 15 schools overall, reach out to them. One of the certain things you can't change, but when you communicate with them professionally, that opens up door that can help a lot visiting them. I think that would be one way. All right. Dr. Riddhi, yep.
Hi, thank you, doctor, for giving me this opportunity. I had two questions. Firstly, last time we spoke, and you told me not to hold reservations to reapply to the same schools.
Yeah, you should
Like
apply
this
to.
is
They
if
like
this,
they like re-applicants. Colorado love re-applicants. Everybody love that.
so I wanted to know if improving the TOEFL and the like SOP and slight changes, would that be good enough, or
Yeah,
you think?
okay, wait. I can tell you change everything. You'll say I can't do that. I have money issue. I have family. I have time issue. So the point is not that you want to change everything. The point is you're applying again and you're saying, whatever in my capacity I could have improved, I've done it. I've done TOEFL, I've done this, and I'm trying my best. Take it or leave it. You're a student. You're an underdog. You're a fighter like a Rocky. You're not somebody who's already a belted champion. So it's not about you have to do everything. What you're showing on that piece of paper is, look at me where I started from and look at me now. And I'm somebody who's not great, but look at my trajectory. That's what you're trying to convey. A student is never liked because he knows a lot. A student is liked because he's working hard. That's the philosophy you want to show in your personal statement.
So, you think that even if there are slight changes, we can still apply and it makes sense that
Doc,
we
doc,
apply?
doc, if you listen, now I'm going to repeat myself. You're using the word slight changes. I'm using the word whatever you have done. I'm not using slight or because God knows, like, you only your whatever your life responsibilities are, you did the best you can, and nobody can judge you, right? It's your life, you made the best. So I'm not even using the slight word. I'm repeating again that you mentioned in your statement that over the past years, I've worked hard and I've done this, and I'm still very much interested to be a part of your program. And that's it.
And you think ADAT would make a better impact if I try giving
If
ADAT?
if you can get good score in ADAT, yes, it will. Just giving ADAT doesn't make anything better. Getting a score around 600, above 550, that's when things get better. Giving TOEFL is not a accomplishment. Getting score above 105 is an accomplishment. So that's how I would look at it.
Okay, thank you, doctor. And another question that I have is, can we simultaneously apply for Caapid and AEGD? Like, I don't
I'm
have
not sure.
specialization, but if
I'm not sure. If you want to try, you can. People have done it. I don't have a definitive yes or no.
okay.
Yep.
And you think like AEGD, they have acceptances even if you don't have the master's
Doc,
degree?
Doc, I don't have the answer to. Somebody asked me this question. The AGD's criteria are different. I never got accepted to one or looked very deep. They mostly look into clinical work. That's what I know. Now, I don't know your profile exactly, but people do get accepted. Now it's up to you if you want to apply. They look, one thing I can tell you is they focus on clinical. Okay.
Yeah, like if I have done like 5 years of
So,
clinical practice in something.
Doc, I can't spend all, I did answer what told you.
Sure, sure. Yeah.
You need
Thank
to
you very much.
understand, you need to utilize the principles I said and use whatever I have to make out of it. I can't go into deeper and deeper review because there's other people too. So yes, whatever clinical you have, write it in a good way and show yourself as a competent person. I don't have all the answers. One of my biggest problem that, and a lot of female candidates don't understand when they are stressed out and then they see this person on YouTube being very confident and like he knows everything. To be honest, I don't have all the answers, especially when it comes to visa, AGDs, even acceptances. There are certain things I don't know. And I tell people when I don't know anything, I'll just tell them, be the best version of yourself and just jump in. See what happens. You're going to lose money, maybe, or maybe you get an acceptance. I don't work with God. I don't know what his decisions are in your life. What I know as a human being from my own life is just put the best version of yourself and just give it a try. But the problem is the anxiety level are so high. Literally, I felt like at times people are grabbing me like, give me an answer. And I'm like, I don't have one. And I'm scared of giving wrong answers because if it goes south, you're gonna say Adriel made me do this and it like my money got wasted. So to be honest, in your situation and for other people as well watching this, I would suggest there are certain places nobody can give you an answer and you won't get an answer. The only thing you can do, if you have an intuitive feeling that you want to do it, just think about it and take a leap if you want to and see how it goes. So that's how it is. Like nobody can actually find, because you're creating your own patterns and you're finding your own ways. All right.
Sure.
So,
Thank you so much, doctor.
sure thing. Dr. Jan.
Hello. First of all, thank you for this session. My question was, I have done BDS in India, and then I have done dental hygiene program in the US, which was 2 years. So would it be I know you said it's not a good idea to take a letter of recommendation from a dental hygienist, but what about the program director of the whole program, dental hygiene program from a university?
Oh,
What would
if
you
you went to a
suggest?
dentist school and that person is the head of the dentist school with the letterhead of that, yes. Because
Not dental school, dental hygiene school.
yeah, dental
Okay, okay.
hygiene institution, then it's a good idea. But if
Okay.
it's a randomly person, then no. Okay.
No,
Yes.
yeah,
Certain,
she's ready to give me a letter of
yes.
recommendation stating my work.
Yep.
So
Then it's good because the letterhead would be an institution. Yep.
okay. So that is better than getting from a professor, dental professor from India. What would you say?
You can take the dental professor and put it in the extra one
Okay.
supplement. Okay.
Okay, okay. Thank you
Alright.
so much.
Sure thing. Thank you. Thank you for your straightforward question, Doc. I appreciate it. Dr. Paulina, yep. Pauline, sorry, I came.
So, Doctor, one last question. I was planning on applying to both advanced standing programs and residencies. So, when we do apply in that way, is it does the school feel like, oh, she's applying to two programs, and it makes
Same answer
her
I gave her. I don't have the answer, to be honest,
okay?
because I didn't
Okay.
had many people who went through this, and I don't know why how school would see it. But
Okay.
to be honest, if I don't have the answer now. I'm just going into my own blah blah land. If I'm
Yes.
gonna do it, I would pick one. I don't wanna.
Okay.
This doesn't look professional. Somebody who's
Yes.
more purpose driven in life would have a more specific goal. That's what
Understood.
would look at.
Okay. Thank you.
Sure. Yes. Doc Navia, if I'm saying it right. Yes,
Hello,
Doc.
yeah, it's Navya.
Okay. Yes, Doc. How can I
So,
help?
yeah, I actually wanted to ask you one thing about the dental interview.
Mm-hmm.
So, recently I had a interview from Boston. So, the one thing I didn't know when I was giving the interview was like how much the time we can when the interviewer asks you to tell about yourself or
This
when
Doc, how did you know how much time you're gonna take to ask me this question?
Yeah, I get it, but when I was giving the interview, I started telling about myself, and then I once I thought like, am I going like too deep into that, or like I really didn't get like how much is the good time, or
Doc, I'm asking you right now.
yeah.
You were gonna ask me this question. How did you know what would be a good amount of time to ask this question? 1 minute, half minute? What in anybody, any human's brain, how would they judge?
I don't know.
Yes, I'll
Yeah.
give you an answer. I'll give you an answer. When you start a conversation, number one thing is you make sure that you want to engage the other person and you keep an eye out on their face and see if you're having a conversation which is engaging. Right now, I'm speaking to you, but I'm on purposely a little bit faster because I can't see people. And
Yeah.
I keep speaking slowly and I'm going into detail. This is called emotional intelligence, Doc. You can read it on YouTube, Google. This is something you build over time when you're having conversations. I can't teach you this right now. This is a whole different philosophy. Like this is something I talked in videos and all of that stuff. But just communicate with people on the streets, on your work and your family, and learn to have better conversation. That would be the true answer to it. But to help you out a little bit more, in the WhatsApp group, I'll share the videos. Start watching it, because there's no like a magic trick. My problem with a lot of candidates is they are looking for quick fixes, when especially when it comes to conversations. This is something you just learn and practice and build. One other thing, I'll send you the videos, and next time if you get an invite, you can reach out to me and I can give you something more specific or detailed. All right.
Yeah, thank you for your inputs. But precisely, I want to ask just one thing. Like, when they ask, like, tell me about yourself, we can't just tell about our whole resume or like whole, the whole life of us, right? So,
But
I just want to know, like,
Doc,
uh,
what I'm trying to tell you is that I have made 10 minutes of video on just tell me about yourself. I
okay,
can't repeat all of it. That's why I'm saying if you have a
Mhm.
little bit patience after this call, I'm gonna send it to you. It's on
Sure,
YouTube.
sure,
I posted
definitely.
it 3 years ago. I have it for you ready. If you give me, I have some time after this, I'll share it with you and other people so they all of them can watch it, right? So and it's much
Yeah,
more in
sure.
detail. So that in that I have made a video which specifically teaches people how to answer. Tell me about yourself, how much time you should take, and what are the key things. It's actually one of my most watched videos. So I'll share that with you in the next few minutes after this call. Okay.
Yeah, sure. Actually, I watched that video already.
You did.
Yeah,
So I don't have
yeah,
a specific timer on it, to be honest. I just
yeah,
have
okay.
conversations you have to read other people. That's the timer. And you, there's, I, I don't know. I never put a time on it. You have to find what's more important in your life and have to be, you have to read the other person, have to read the room. That's the answer. Again, if you get another invite, reach out to me. At that time, I can help you out a little bit in more detail. But up here while sitting, because the way to teach, when I do one-on-one interview, I listen to some of these people there might be few who have done interview prep with me. I take 30 minutes listening to their life, where they're coming from, what they have done, and I keep listening. And then I say, I'm going to be you for a minute and I'm going to give you your tell me about yourself. So I become them, and I've done this in a lot of other videos where I do it for candidates and then I give them an answer. And then that way they're like, okay, this is a little bit long or short and I can change it. And I said, these are the main things you should be speaking about. But this is a whole separate process and I can't give everything right now because it will require a lot of time.
Yeah, I understand. Thank you so much.
Sure thing, Doc. Thank you for
And
your
thank you for the
understanding.
session too.
Sure thing, Doc. I asked this question from ADA last year. They told me that your exam is lifetime. You cannot repair once you have passed the exam. Good. So thank you for mentioning them, Dr. Majid. Thank you. Other questions, guys. How do we select school? Can you provide a few criteria? Doc, I made a whole video on that, about 3 hour session. I'll share it in the group. It talks, some of these guys might have seen that video. I've talked about how to select schools based on your visa category, based on the number of seats they have, and the schools that are near you. So I will share that video. That will help you. Any last questions before I end this session and my throats die on me? So go ahead. Uh, Somebody asked, volunteering in American and Red Cross is better than volunteering in hospice care. Doesn't matter. American Red Cross is more recognized institution. So on a letterhead, it's actually better off. Uh, okay. Any other questions, guys? All right. I think this session was helpful. I'm just running out of time and my throat is gonna give me a harder time if I keep speaking more. But if you have any other questions, well, you can ask me right now. Sometimes what happened, people would text me after this session. So if you have any other questions, I'm gonna stop the recording in case you want to ask something more. And thank you, Dr. Mahad and other people who sticked around and didn't even ask a question, but they were just listening. So I appreciated. Uh, Thank you. And I got some tea, so I can answer a few questions if somebody wants to. I'm gonna stop the recording. So somebody wants to ask a little bit off the chart, they can, okay?